Hello everyone. Today let's discuss about a short clinical case. So we had this patient who came to OP who was a 70-year-old male patient, has come to OP with complaints of swelling in right hand wrist region since 3 months. Swelling was initially small in size but has now grown to present size. Swelling was progressive in nature and patient was finding difficulty in performing daily activities. Swelling was not associated with any pain. On examination, inspection, swelling was present on right wrist region. There was no discharging scar or sinus. Palpation. All boundaries of the swelling were palpable. There was no local rise of temperature. Swelling was mobile in all directions. So this was the swelling which was seen on right hand in the wrist region. So we have sent the patient for ultrasound and the ultrasound report has shown as suggested as infected ganglion cyst. So what is a ganglion cyst? So basically a ganglion arises out of a joint like a balloon on a stalk. It grows out of the tissue surrounding a joint such as ligaments, tendon, sheath and joint linings. Inside a balloon is a thick slippery fluid similar to the fluid that lubricates your joints. That is nothing but a synovial fluid. So what is this is? This is the stalk. This is the cyst. This is usually arising from the tissue surrounding either the ligaments or the tendons, arising either from the hand or in the wrist region, but in the lower limbs it can occur even in the ankle or in the foot region. Risk factors: osteoarthritis can be one of the risk factor. Ganglion cysts are the most common mass or lump in the hand. They are not cancerous and in most of the cases are harmless. They can occur in many locations but most often on the back of the wrist. These are fluid-filled cysts, can quickly appear, disappear and change in size. Many ganglion cysts do not require any treatment because as it significantly regresses on its own, we do not do any aggressive treatment. But if it is causing significant nerve compression, patient usually comes with complaints of pain, tingling sensation and all. So most commonly can occur at any age group, but usually between 15 to 40 years of age group. Women are more commonly affected when compared to men. They are common among gymnasts who repeatedly apply stress to the wrist. So what happens is when there is repeated micro trauma to the wrist, it can lead to formation of the ganglion cyst. Clinical features: most of the ganglion cysts are asymptomatic. Patient will not have any type of complaint of pain. But sometimes if the cyst is causing significant compression on the nerve, patient comes with complaints of pain, tingling and muscle weakness. Treatment options: conservative management. If it is significantly small, we'll just reassure the patient that it will reduce on its own and we'll ask the patient to come back if it is increasing in size or if it is causing any significant pain. And one of the treatment management can also be excision of the cyst. Excision of the cyst is the definitive management. Aspiration. Usually aspiration is not preferred because in aspiration we only drain out the fluid. But aspiration often fails to eliminate the ganglion because the root or connection of the joint or tendon sheath is not removed. So aspiration is usually not preferred. So in this case also we have done excision of the cyst and the excised cyst, we have also sent the tissue for histopathology, and the histopathology report turned out to be an infected ganglion cyst, and we have also sent the pus for the pus culture sensitivity, which showed the report as sterile. Serial subculture showed sterile, but still we have put the patient on antibiotic and we have discharged the patient. And so this was a case of ganglion cyst. Thank you.